You're listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, this is Dr. Marzell. Today I'd like to talk about hormone replacement therapy, and I'd like to emphasize how to do the best application for this so it's the healthiest, the best for you. And there's actually quite a few choices to make about this. It really helps to know how hormones work and what is best for your particular body. So, hopefully, you will get lots of information from this little talk. First of all, I want to talk about the difference between oral application of hormones and topical. Most people who are doing a lot of hormones know very well that oral increases the risk of clots and strokes. Therefore, birth control pills or anything that you swallow, estrogen pills swallowed, will increase risk of strokes and clots. Now, why is that important? Well, of course, you don't want to get strokes and clots, but why does that happen? Why can't you swallow hormones and have them work? Well, we can kind of go back to what's natural for the body. Now, if you swallow a hormone pill, it goes directly into your gut, of course, through your stomach and into your intestines, and is absorbed through your lymphatic system. And the lymphatic system goes directly up to the liver, and then the liver breaks down things and decides if they should be absorbed or detoxified. And then, if it's a hormone, it will throw it into the circulation. Now, if you do this consistently, if you're swallowing hormones, it puts a load on the liver. And guess what the liver does? And it excessively stimulates the liver. So I'm going to put this in really simplistic but important terms. The liver makes clotting factors. So if you instead apply hormones to the skin or use a ring or a gel or a cream, it's anything applied to the skin, gently goes into the body, and it goes into the circulation first. As it's going into the circulation, it goes to organs that need and want estrogen, like your brain, muscles, joints, bones, heart, arteries. And then, after it's gone through all this, then the circulation takes whatever is left of the estrogen back to your liver to detoxify what's there and eliminate it. So you can imagine that the amount of work that the liver has to do if you apply something topically is a lot less than if you swallow something, and that's where it goes first. That is why, so now you know why that works much better. And this is the natural way things happen. When your ovaries produce estrogen, they directly secrete it into the circulation. And it goes around to different organs doing its thing and helping provide estrogen. Then it goes to the liver to be broken down and eliminated. So natural usually ends up being a lot better. Okay, so I wanted to also mention that a lot of people don't get this difference and they still think it's probably not a good idea if you're taking estrogen. If you're having surgery, stop your estrogen, for God's sake. Um, and I want to mention that there is a particular genetic disorder called Leiden factor 5. This particular malady in women um, produces an over tendency to form clots and strokes. So there have actually been studies on this particular population using topical estrogen, and they found that there was no increase in this population that forms clots very easily at the drop of a hat. When they were given topical estrogen, they did not increase clots or strokes. So I think that's very important to note. Okay, so I would also like to talk about what kind of administration is done and why different ways of administering hormones, which ones are better, which ones do you have to worry about more, and so on. So let's talk about estrogen first. Of course, this is the most important hormone if we're talking about estrogen and progesterone. Estrogen is the maximum guy. One thing to note about it is extremely vasoactive. Now, what does that mean? That means it likes to dilate blood vessels. So, what does that mean? Well, let's take an example. If you were going into menopause, you may have noticed as your estrogen decreases in your body that possibly your blood pressure has been going up a little more. The reason is that that vasodilation of the arteries will keep your blood pressure lower. And this is why it is really important to administer estrogen in a stable form that isn't going to be going back and forth where it reams into your body and it relaxes all your blood vessels and then it drops after a few hours and then they all start closing up and then it opens them up again. We don't want that. And the population that is really affected by this is women who have migraines. So I'd like to talk about the different types of options that are there for administering estrogen and why the pros and cons and how you can get the best application for the most effective administration, particularly if you might have migraines and problems like that. Okay, so estrogen topically is available in patches, gels, and a ring. If you have it compounded, it could also be compounded in a cream. You want to have, I wanted to mention when we talk about products from the drugstore versus products from your local compounding pharmacy. A lot of people think that the local compounding pharmacy is where you can get natural hormones. And the drugstore, they're all a bunch of synthetic junk that you shouldn't even get near. Well, that's not true. Hormones that are being used, estrogen and progesterone, come from a natural source, wild yams and soy. And what happens is there is a similar substance that looks a lot like these but isn't. They are extracted from these plants and then they are chemically changed so that the final result looks absolutely bioidentical to what your body would produce. Now, it's possible that you could collect a bunch of ovaries and try and extract estrogen from the ovaries from animals or something. But when you have the final product being the exact molecular structure, you've done your work. This is a bioidentical product. It's available in the drugstore and it's available in the compounding pharmacy as well. Now, I want to mention that hormones are fat loving creatures. They are made from cholesterol, is where all hormones come from originally. They're not manufactured for the drugstore or the compounding pharmacy in that way from cholesterol. But in your body, that's where they come from. This is the raw material to make them. So, if you apply hormones to a fat pad, like your abdomen, this happens all the time in my practice. People will put patches of estrogen or something, or they'll rub it on their abdomen. Well, it will sink in and it will find a bunch of fat that is there to protect your intestines. And that fatty apron over your intestines, well, it's like it's coming in from fatty friends. And this is a fat soluble substance. It may just build up in that fatty layer. So it's better to administer topically hormones over a muscle. I usually tell people for patches to apply it over their upper outer hip in the back. There's a nice muscle there and it sinks in and then it will go throughout the circulation. Also, if you go to the compounding pharmacy, and some people are wanting people to administer progesterone in a cream. Remember, this is a fatty substance, a cream. The progesterone doesn't want to leave its fatty friends. So it makes it more difficult to absorb if it's in a cream and it's supposed to go throughout your body. So what practitioners often tell patients is put it on the inner layer of your arm. Now, this is particularly bothersome when you have a substance that can stimulate breast tissue. And progesterone is extremely stimulating to breast tissue. If you have excess stimulation to a tissue like that, you have a risk of cancer being produced. So the last thing in the world that you want to do is put progesterone on your inner arm, because the lymphatics and the flow of your circulation goes right up towards your breast tissue. Please do not do this. Let me talk about gels. Gels are absorbed very, very easily. You can put them almost anywhere. I usually tell patients to apply gels to your thighs. They go in very quickly, and the problem with gels, they go in easily, no problem, and they're great for people that like to swim every day, or they're showering all the time, or they're working out a lot and they get sweaty and patches aren't staying on very well. However, they zoom into your body and they go through your circulation, but they're not very consistent. So they may not be the best choice for someone with migraines. Patches are pretty consistent. You put them on a muscle and they're bleeping out a consistent daily amount of estrogen. Now, The deal is with patches. You can get twice a week patches, which are changed every 3.5 days. I I think most women are so busy that it would be difficult to remember every 3.5 days. But let me tell you how it gets into the body in that way. Day one, you're low in estrogen. You put the patch on. It's not real great. Day two, you're feeling pretty good. Yoo-hoo! Day three, it's on its way down already. And by day 3.5, you need to change it. So this is some inconsistency with a short-term patch. Now, the week-long patch is much more consistent, but it also doesn't suddenly have the same level exuded from the patch for 7 days and then suddenly there's nothing. It doesn't work like that. It'll stay consistent for about 5 days. This is really important. After 5 days, the estrogen level starts dropping in the patch. Sometimes as much as 30%. That's quite a bit. When you have a vasoactive hormone dropping, you're going to have vasoconstriction. This can cause a migraine. And this is why a lot of women will say, oh, I tried taking hormones, but I got migraines. I couldn't take it anymore. And the important thing to do with patients who notice this, and by the way, other patients who don't have migraines may notice that they're doing fine those first 5 days. But after 5 days, they're going to drop. And they may notice sleep disturbances, or being more emotional, or more tired, or starting to have muscle aches, or other things like that. So if you have a week-long patch and you have the patient put on a new patch on day 5, it will be adequate dose and consistent. But you may need an extra package of patches to apply in this way, because the insurance companies thinks that if it says weekly patches, it will last for the whole week, and that's not correct. The other thing I'd like to talk about is rings. So rings are wonderful, wonderful way to administer estrogen. A lot of people don't remember diaphragms, but they were a little ring that would hold creams that would kill sperm, and women used it for birth control, and you just self-apply. And the rings for estrogen replacement are also self-administered, and they last for 3 months. So particularly for women that can't remember, that have 10 million meetings they have to go to and plenty of things to do. Putting a ring in and not worrying about it for 3 months while you have that consistency of application, and it's a vaginal ring, so you have easy, the vaginal mucosa can suck up estrogen very easily, so it's not like you have to worry about it being what is it really exuding anything or not. The fact that it's touching the vaginal walls, it will be absorbed. And I would like to see more people use rings. Now, insurance does not. Why don't they? Because insurance is not covering rings. Why doesn't insurance cover rings? Because they're more expensive. And they're more expensive because they last for 3 months. Now, the solution to the ring problem is look for coupons on the internet. They're out there for rings. And it's too bad that this is such a great tool for women to use. But again, it's just not covered at this point for insurances. I'm going to end there, and I hope that you've learned some interesting points about application for hormones and what might work best for you and why. Stay tuned for more exciting podcasts, and thanks for listening.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.